My name is Cheung, and I'm a researcher at Bangor University. Today I'll be presenting to you the findings of our study, the impact of Covid-19 on student mental health. Covid-19, or the coronavirus, likely needs no introduction from me, but in short, at the time of this recording, the world is currently in the midst of a pandemic. Pandemic which started in 2020 and has caused huge amounts of interruption in daily life, and also huge amounts of social isolation in the form of local and larger scale lockdowns. Past research highlights the dangers of social isolation, very much so, and this is social isolation in a way we've never seen before. We're very much in uncharted waters in terms of this scale, this magnitude of isolation. We've seen animal research kind of presenting developmental disorders in young animals which have been isolated. We've seen a strong correlation between isolation with loneliness, depression, and anxiety. And in a way that this kind of research serves as a blueprint on what to expect in terms of outcomes of COVID-19 and the lockdowns. And so the question at hand is, why conduct this study? Why conduct research on student mental health specifically? To answer that question, we kind of have to look into the current evidence base into COVID-19. The current evidence base is hugely lacking. It's just not there. It's as mentioned, we're in uncharted waters, we're in novel times, and not to mention the vast majority of the research has been conducted in China, the origin of the virus. And so we can look back at past research and kind of reflect on what to anticipate, but the demand for context-specific research is very much important. Very much important in the sense that without it, forming effective intervention is not really possible. Any interventions formed currently would very much be hypothesizing based on past research without collecting the appropriate amount of data from the current context. In spite of this, however, there is new and emerging research into the field. A lot of it hypothetical interventions, a lot of them speculative due to the fact you can't really gather empirical data at this point due to ethics and how new everything is. But also there's research suggesting potential risk factors and high-risk groups. One group in particular, young people, and alongside that students. The research kind of indicates they are particularly vulnerable during this COVID-19 era. With all that considered, the current study hypotheses. Now again, this is a study looking into the effect of COVID-19 on student mental health, and what we're anticipating is a self-report of decreased well-being, decreased mental health and satisfaction with life. Hypothesis 2 is we expect that the participants will anticipate a long-term adverse effect on their mental health. And finally, hypothesis 3 is we're expecting poor access to mental health support both during and after the lockdown. And to test these hypotheses, the methods of the current study. So, participants 214 with 53 male and 161 female. There were originally 281 participants, so we've had to exclude 75 due to failure to consent, or either failure to consent or incomplete questionnaire responses. And participants were recruited through the Bangor University recruitment system for psychological studies and also social media. The study was administered online. Participants were asked to self-report retrospectively their responses, and participants were asked to complete demographic questions, age, gender, and some objective lockdown questions regarding whether they were shielding or if they were isolated. And subsequently, they were asked to complete two questionnaires, the Warwick and Edinburgh Mental Health and Wellbeing Scale alongside the Satisfaction with Life Scale. Now, participants were asked to complete these two studies at three different time points retrospectively, so before lockdown, during lockdown, and after lockdown. Upon completion of these measures, participants will be invited to respond to the novel open answer questionnaire created by the researchers. And these were kind of questions to discern more information from the quantitative data. Questions such as, how did this lockdown affect your mental health? And what positive experiences did you learn from the pandemic? Please note that all references and measures can be found in the handout. And now, with the understanding of how the study was run, results. So, repeated measure ANOVAs were run to determine whether or not there was a significant difference between participant responses across time points and across interactions. Pairwise comparisons were run to determine whether or where those differences were, and at which time point and at which interaction. And following on from this, in regards to the long answer questions or the open-ended questions, themes were drawn and analysed with the most prevalent themes being displayed later on in the presentation. So up on the screen you should be able to see the line graph of the Warwick and Edinburgh Mental Health and Wellbeing Scale. Here we've charted on a line graph the mean scores across all time points. Following the repeated measures ANOVA, we can see a significant difference in mean scores across all time points, with the largest mean difference being before the lockdown and between the before lockdown and during lockdown time points, something we did expect to see. Comparing scores from during and after conditions, we can see that the well-being score did increase between these two time points. And something to note is that although the well-being score did increase between the two, the scores never go back to baseline. It never goes back to the before condition. I think that's quite a noteworthy observation. And I think you could quite easily infer from that, possibly the idea that well-being scores don't return to baseline because there's been a long-term impact. But that's something we'll come back to when considering the long answer questions. And now on to the satisfaction with life scale. Again, the same analysis has been run here. So the repeated measures ANOVA demonstrated a significant difference in mean scores across all time points, and is actually mirrored again with the pairwise comparisons, with the pre-lockdown and during lockdown condition being the largest mean difference. Again, the scores do increase from during to after, but never return to baseline. And moving on to the long answer questions in the novel questionnaires. On the following two slides, we've outlined 4 of the 7 open answer questions and the most prevalent themes drawn. And with question number 1, we asked participants to respond to how they found that COVID-19 had impacted their mental health and well-being. And responses essentially mirror past research. Stress, anxiety, and loneliness all being very, very prevalent themes in past research regarding social isolation. And though the responses here on the first question were kind of expected in a way, the response to the second question was actually a bit of a surprise. We saw that the majority, 29%, of support accessed was actually counselling, professional help, and friends and family coming in second place, actually, with only 25% of responses, which is still high, but I suppose the expected outcome would be that counselling would be lower down the list due to poor access potentially. In regard to why participants did not access mental health support, well, the overarching theme here was kind of that participants felt that their experiences and their feelings did not necessarily warrant the need for well-being support, and I guess it's potentially concerning depending on how you interpret that response. But ultimately, I suppose the theme here is that that mental health here was not accessed due to the feeling that it wasn't overly necessary, and there were other people that needed it more. Now, the final question we're covering here is how long the participants expected the effect of COVID-19 on mental health to last. And we spoke before about the while reviewing the quantitative data, kind of the idea that the scores, well-being scores and satisfaction with life scores, never return to baseline, potentially suggesting a long-lasting effect. But what we're seeing here is actually most participants expecting things to, well, expecting the impact to cease in a few months or very soon, which to me sounds like that they see the negative impact to be contingent on restrictions, lockdown, and regardless, it seems to be something they're optimistic about, something they're expecting to end sooner rather than having a long-lasting effect. So at this point, we've had a brief look into the background of COVID-19 and the current study. We've had a look at the methods, how the study was run, and also the outcomes of the study. Now we're going to have a brief look and discussion on what the results actually mean. The quantitative data is very much strong. The trend line is quite apparent and clear, and we can kind of tell from this that mental health in students, mental health and well-being has indeed been impacted negatively by the COVID-19 pandemic, to the point that in terms of the measures and the self-report scales, that well-being and mental health does not return back to baseline, never returns back to pre-COVID, which of course has some serious implications. The idea that this pandemic and this event has created a long-term adverse effect in this population is very much concerning, and kind of just highlights the demand for effective intervention, which leads nicely on to hypothesis 1, a self-report of decreased well-being and satisfaction with life. Most definitely, we've seen a significant difference going from pre-COVID to during COVID pandemic, and the self-report has decreased in our current study. However, looking back at the qualitative data, long-term effects are actually apparent, but not necessarily anticipated by the students. The students actually are expecting the adverse effect to end contingent on lockdowns and restrictions. So we can conclude that actually hypothesis 2 was not met. And finally, mental health support arguably was considerable. It was observed that mental health support, the spread at least, was actually primarily professional help, with counselling being the most prevalent form of mental health support. And thus, the current study has highlighted and enforced past research on high-risk groups in the form of the student and younger people population. It's very much important to note the potential for long-term adverse effects as caused by the COVID-19 pandemic, and thus highlighting the need for empirical research interventions. Thanks very much for listening.